Let me ask you something nobody else will. If your blood pressure medication is working, why are 675,000 Americans still dying every single year from hypertension-related complications? Why do people faithfully swallow their pills every morning, watch their sodium, and still end up on my operating table with their chest open and their heart in crisis? Nearly half of all American adults, around 122 million people, have high blood pressure. 3 out of 4 of them are on medication. The numbers on their monitors look controlled, and yet they keep dying, keep having strokes, keep suffering heart attacks. I've seen it with my own hands, literally. My name is Dr. Michael Kent. I've spent over 2 decades as a cardiac surgeon, opening chests, repairing hearts, and watching people pay the ultimate price for a problem their doctors told them was under control. After more than 20 years in the operating room, I can tell you with absolute certainty, what you've been told about high blood pressure is dangerously incomplete. And in the next few minutes, I'm going to tell you what your physician probably doesn't know, or has never stopped to explain. Not because doctors are bad people, but because the medical system trained them to manage symptoms, not reverse disease. Stay with me. Every single word of what follows could protect your life. If this is already making sense to you, subscribe to this channel right now. Every week I share surgical insights designed to keep you out of the operating room. Your doctor told you hypertension is a plumbing problem, too much fluid in the pipes, so the solution is obvious, right? Cut the salt, take a diuretic, drain the excess, watch the pressure drop. Except that entire model is 50-year-old thinking, and it's not just outdated, it's dangerously misleading. Here's what actually happens when I open someone's chest after years of hypertension. A healthy artery has elasticity. It springs back when I make an incision like a fresh rubber band, but a diseased artery from someone with chronic high blood pressure, it doesn't spring, it doesn't flex. Cutting into it feels like cutting into bone, hard, calcified, dead. That is hypertension, not too much fluid, destroyed pipes. Your arteries aren't simply overfilled, they are structurally damaged, rigid, deteriorated, calcified at the cellular level. And here's the brutal truth: no blood pressure medication on the market repairs that damage. Not ACE inhibitors, not beta blockers, not calcium channel blockers, not diuretics. They lower your reading. They do not repair your arteries. And that distinction is the difference between managing a disease and actually reversing it. To understand what's really happening in your blood vessels and what can genuinely fix it, you need to understand 4 hidden mechanisms that your doctor has almost certainly never discussed with you. Inside every artery in your body, there is a single layer of cells called the endothelium. Think of it as the wallpaper lining your blood vessels, thinner than tissue paper, invisible to the naked eye, and absolutely essential to keeping you alive. Coating that endothelium is a microscopic protective layer called the glycocalyx, a mesh of sugar molecules and proteins that acts like a non-stick shield. When it's intact, blood flows freely. Inflammatory molecules can't attach to your vessel walls, and your arteries produce a chemical called nitric oxide that keeps everything relaxed and open. Research published in Pfluger's archive in 2007 established that the glycocalyx performs 3 critical jobs: creating a frictionless surface for blood flow, blocking inflammatory damage, and triggering nitric oxide production. When it's healthy, your blood pressure stays healthy. But when it's damaged, everything falls apart. What strips the glycocalyx away? Elevated blood sugar, chronic inflammation, cigarette smoke, oxidative stress. Once it's gone, your vessel wall is exposed. Inflammatory molecules rush in. LDL cholesterol penetrates the vessel tissue. Plaque begins forming. Nitric oxide production plummets. Your vessels constrict. Blood pressure rises. And no medication rebuilds the glycocalyx. Ever. The drug companies don't have a pill for this. Your pharmacist has never once discussed it with you. But this is where hypertension actually begins. Not in your kidneys, not in your salt intake. Right here, in the invisible shield inside your arteries. This second mechanism is the one that genuinely shocks my patients when I explain it, because most physicians never even look for it. Inside the middle layer of your artery wall, called the tunica media, there are elastic fibers and smooth muscle cells. This is what gives healthy arteries their flexibility, their ability to expand with each heartbeat and bounce back. It's what makes them alive. But with chronic hypertension, diabetes, or systemic inflammation, 3 catastrophic changes begin. First, calcium deposits start forming. Calcium belongs in your bones, but when vessels are chronically inflamed, calcium migrates from your bloodstream into your artery walls. It crystallizes, it hardens, it makes your vessels rigid. Second, the elastic fibers that gave your arteries flexibility degrade and are replaced by collagen. Collagen is stiff and inflexible. Third, and this is the part that stuns people, the smooth muscle cells in your artery walls undergo a pathological transformation. They stop behaving like muscle cells and start behaving like bone-forming cells, actively depositing calcium and hardening the vessel from the inside out. A comprehensive review published in the Journal of the American College of Cardiology in 2019 identified vascular calcification as the primary driver of arterial stiffness and one of the most significant predictors of cardiovascular death. Research from 2010 in the same journal showed that arterial stiffness predicts cardiovascular events better than blood pressure measurements alone. By the time someone reaches 65 with years of poorly controlled hypertension, their arteries can look more like bone than blood vessel tissue. And here's the question everyone asks: can this be reversed? Yes, but not with any prescription medication. With specific nutritional interventions most physicians have never been trained to use. Nitric oxide is a gas molecule produced by your endothelial cells, the same cells that line your artery walls. Research published in the European Heart Journal in 2012 established that nitric oxide is one of the most critical signaling molecules in your entire cardiovascular system. Here's what it does. When your endothelium releases nitric oxide, it diffuses into the smooth muscle layer of your vessel walls. The muscles relax, the vessels dilate, blood flows freely, pressure drops. Healthy endothelium produces nitric oxide continuously, constantly keeping your arteries in a relaxed, open state. But when your glycocalyx gets destroyed and your endothelium gets damaged, nitric oxide production collapses. The enzyme that makes nitric oxide, called eNOS, requires specific cofactors to work properly. The most critical is a molecule called BH4. When BH4 is adequate, eNOS works perfectly. When BH4 is depleted by oxidative stress, inflammation, or blood sugar spikes, NOS malfunctions. Instead of producing the nitric oxide that keeps your vessels open, it produces harmful free radicals that damage them further. One of the most effective ways to boost nitric oxide production is a protocol that most cardiologists don't prescribe because it doesn't come in a pill bottle. A 2014 meta-analysis in sports medicine examined isometric resistance training and its effect on blood pressure. The specific protocol: squeeze a hand grip device at 30% of maximum strength for 2 minutes. Rest 1 minute, repeat 4 times. Do this 4 times per week. Result: blood pressure drops by 8 to 12 points systolic within 8 weeks. No medication, no side effects. The mechanism is simple. The sustained muscular contraction generates shear stress, physical friction from blood flowing rapidly through vessels, which directly activates eNOS and triggers nitric oxide release. There's also a second strategy almost nobody knows about: nasal breathing. When you breathe through your nose instead of your mouth, your nasal passages produce nitric oxide directly. Studies show nasal breathing can increase blood nitric oxide levels by up to 400% compared to mouth breathing. A simple habit change with a profound cardiovascular impact. Your kidneys control blood pressure by managing sodium balance. When they sense too much sodium, they excrete it. Blood volume drops, pressure normalizes. This is the system your doctor is trying to help when they tell you to cut your salt. But here's the problem they're not telling you about. Insulin blocks sodium excretion from the kidneys. When insulin levels are chronically elevated, a state that affects millions of Americans who have no idea, your kidneys retain sodium regardless of how little salt you're eating. The salt restriction isn't working because the mechanism driving retention isn't sodium intake. It's insulin. Research published in the New England Journal of Medicine in 1987 established that insulin resistance plays a causal role in blood pressure elevation. A landmark 1991 paper in Diabetes Care identified insulin resistance as a driving force behind hypertension, obesity, and cardiovascular disease as a unified syndrome. Insulin acts on the kidneys through 3 distinct pathways. It directly stimulates sodium reabsorption in the kidney tubules. It activates the sympathetic nervous system, triggering aldosterone release, which tells kidneys to retain more sodium, and it increases your blood vessels' sensitivity to angiotensin II, a powerful vasoconstrictor. And here's what makes this especially alarming. You can have severe insulin resistance with perfectly normal fasting glucose and a normal A1C. Your doctor checks those and says, "You're fine." But if your fasting insulin is elevated, your kidneys are stuck in retention mode, and your blood pressure will remain elevated regardless of how many pills you take. Most physicians never check fasting insulin levels. Demand that yours does. Step 1. Restore your glycocalyx. First, stop destroying it. Every blood sugar spike above 145 mg/dl damages your glycocalyx through glycation, a process where excess sugar essentially caramelizes and destroys the protective coating on your artery walls. This means reducing refined carbohydrates, not eliminating carbs entirely, but avoiding the foods that spike blood sugar: white bread, white rice, pasta, sugar, baked goods. Second, rebuild it. The glycocalyx is constructed primarily from compounds called glycosaminoglycans. The best dietary source is fucoidan, a sulfated polysaccharide found in brown seaweed. Research shows fucoidan restores glycocalyx thickness and improves endothelial function. Studies use doses of 600 to 1,000 milligrams daily. Third, flood your system with polyphenols, the antioxidant compounds found in berries, dark leafy greens, beets, dark chocolate, and green tea. These neutralize the free radicals that strip away your glycocalyx before they can cause damage. Example: a 71-year-old on 2 blood pressure medications. Blood pressure controlled at 130/82. After 12 weeks on this protocol, eliminating refined carbs, adding 800 milliliters fucoidan daily, increasing polyphenol-rich foods, endothelial dilation improved from 5% to 13%. Blood pressure dropped to 116/74. 6 months later, off both medications, stable at 120/76. Step 2. Decalcify your arteries. Inside your body, there is a protein called matrix glay protein, MGP. It functions like a traffic controller for calcium, directing it into your bones where it belongs and keeping it out of your artery walls. When MGP is properly activated, your arteries stay flexible. When it's inactive, calcium deposits freely in your vessels. MGP is activated by vitamin K2, specifically the MK7 form. Research published in Atherosclerosis in 2009 found high dietary menaquinone intake is associated with reduced coronary calcification. The Rotterdam study, published in the Journal of Nutrition in 2004, found that higher K2 intake is associated with significantly reduced risk of coronary heart disease. Studies showing benefit use 180 to 360 micrograms of MK7 daily. Vitamin D works synergistically with K2, helping calcium absorb into bone effectively. Dose 5,000 to 6,000 IU daily. And magnesium, nature's natural calcium channel blocker, prevents calcium from entering smooth muscle cells and crystallizing in vessel walls. Most people are chronically deficient. Dose 400 to 600 milligrams of magnesium glycinate or magnesium threonate daily. Example: a 74-year-old on 4 medications. Blood pressure barely controlled at 136/86. CT scan showed severe aortic calcification. After 18 months on this protocol, 306 dengximec K2, 6,000 IU vitamin D, 600 mg of magnesium, calcium score decreased by 16%. Blood pressure 118/76, down from 4 medications to 1. Step 3. Rebuild your nitric oxide production. First, protect and restore BH4, the critical cofactor for ENOS function. Ensure adequate folate, dark leafy greens, vitamin C, citrus, berries, bell peppers, and vitamin E, nuts, seeds. Research published in the Journal of Cardiovascular Pharmacology in 1999 demonstrated that oral vitamin C measurably reduces arterial stiffness in humans. Second, implement the isometric hand grip protocol: 30% of maximum grip strength, 2 minutes on, 1 minute rest, 4 cycles, 4 times per week. 8 weeks to significant blood pressure reduction. Third, and this one costs absolutely nothing, breathe through your nose. Close your mouth during rest, during sleep, during light exercise. Your nasal passages are nitric oxide factories. Use them. Step 4, the insulin reset. You must lower chronically elevated insulin, and the most powerful tool available is time-restricted eating. The protocol is simple. Condense all your meals into an 8-hour window each day, eat between noon and 8 p.m., fast from 8 p.m. until noon the following day. During the fasting hours, drink water, black coffee, or plain tea. No calories. Research demonstrates that time-restricted eating lowers blood pressure by 9 to 11 points systolic within 8 weeks, not because of what you eat, but because of when. The mechanism is purely insulin-driven. Lower insulin unlocks kidneys. Unlocked kidneys excrete sodium properly. Sodium exits, pressure normalizes. Combine this with resistance training 2 to 3 times per week. When muscles are loaded with resistance work, they develop more insulin receptors. Studies show resistance training lowers fasting insulin by 20 to 30% within 12 weeks. The most important thing I will tell you today, I am not telling you to stop your medication. Not today, not abruptly. That would be dangerous. What I'm telling you is this: medication manages the reading on your monitor. These 4 steps repair the underlying damage. You need both initially. Start implementing these protocols while continuing your current prescription. Monitor your blood pressure daily at home. Track the trends. When your numbers consistently improve and stabilize, have an honest conversation with your physician about gradually reducing your medication under medical supervision on your timeline safely. Never stop medication suddenly on your own, but also do not accept the idea that medication is your only option for the rest of your life. Conventional medicine doesn't know how to reverse vascular damage. They've never been trained to. But now you understand the mechanisms, and when you understand mechanisms, you can correct them. Glycocalyx restoration, arterial decalcification, nitric oxide revival, insulin reset. These are not theories. They are evidence-based interventions supported by peer-reviewed research published in the most respected cardiovascular journals in the world. They are the difference between managing high blood pressure and actually healing from it. You now carry knowledge that most physicians have never been taught. Knowledge that 675,000 Americans who die each year from hypertension complications never received in time. Use it. Implement it. Start today, not tomorrow. Subscribe to this channel. Dr. Michael Kent shares surgical-grade knowledge every week to help you protect your heart, reduce your medications, and stay out of the operating room. Share this with someone who needs it. It might save their life.